Hi everyone, this is Amara, aka Sister Yoni, and if you don't know, I am a doula and a black birth worker. Today I had a visit with my client, and we just went over her birth plan, any comments, questions, concerns. We did some aromatherapy, some affirmations. Um, we did some sound baths. We talked about pain management, um, and just basically, I asked her, what is it that you require of me so that I can assist you to have the best possible birth that you can have. So I just want to for a lot of people, a lot of women aren't familiar with birth plans. And it's simply just literally, it's how you want your birth to go. Um, Everyone is different. Like part of your birth plan can be like, okay, I want a home birth, or I want a birthing center birth, or I want a hospital birth. But just for example, I'll go down this list and just talk about some things. So, um, part of her birth plan was that she wants to labor at home as long as possible, which is a great ideal. You want to spend as much time at home, just preparing yourself mentally and spiritually, walking, meditating, drinking herbal tea. You and your husband can have sex because that will also definitely stimulate or hasten the labor. Um, just doing whatever comes naturally, whatever your body is telling you need to do. If you need to squat, if you need to get down on all fours, if you need to walk around, if you need to get in the showers are really good at relieving kind of the pressure and the tension. And a lot of times we talk about having birth or giving birth in tubs and pools, but shower birth is also an option. So we talked about that, laboring at home as long as possible. Then we talked about the fact that she wants a vaginal birth after cesarean or VBAC, which is very possible. Do not let these doctors and nurses tell you that you cannot have a vaginal birth after cesarean. I've heard this from a lot of women, particularly black women. They don't know, they're not educated, they're not aware, or they've just been straight up lied to, and they have these medical professionals who are telling them that it is impossible or it's not safe to have a vaginal birth after cesarean, which is not true. Now, however, if you have underlying issues, preeclampsia or gestational diabetes or some sort of heart or cardiac issues, I would consult with my doctor about the vaginal birth after cesarean. But what they don't tell you is cesarean puts even more stress on your body because it's an actual surgery. A cesarean is a full blown medical surgery. So it's more tension, more stress, and it puts your body through way more work, and it takes longer to heal after getting a cesarean. So we also discussed she wants no AROM, which is artificial rupture of membrane. So she doesn't want them to rupture, you know, the water sac. So she wants a natural water eruption. She wants her water to break naturally, which of course is the best thing. Guys, look, I know we hear natural birth this, natural birth that, and people like, oh, you're such a hippie or you're into that new age stuff. That first of all, this is not new age. This is very traditional. This can be traced back to Africa. um Labor birth is normal it happens. It's a physiological occurrence. It's not a medical emergency until it turns into one, due to just inadequate health care or inadequate doctors, nurses. But anyway, so she wants no artificial rupture of membranes. We also talked about, let's see what else. No episiotomy. I hear a lot of women talk about those. You do not have to get that. No epidural. Which I'm all for. Like I said, epidurals, they put a lot of strain on your body because after applying the local anesthetic to your lower half of your body, it kind of puts more pressure on your body and your uterus, because now it has to like push without you like feeling it in your body. Like, that's why you feel the contractions, because your body tells you when it's ready for you to bear it down and to push, but it can't do that if the signals aren't going to your brain because of the epidural. We also now, she asked, well, she didn't ask, but part of her birth plan was Pitocin. She said, but only if necessary. However, I was able to talk her out of getting Pitocin, because Pitocin artificially causes your uterus to contract. And what they don't tell you is that sometimes these contractions are so just so frequent and so strong that your uterus can burst. You can Google this. You can go read articles in medical journals. It's true. Sometimes Pitocin can cause adverse effects. So I talked her out of that. We also discussed possibly, but only if necessary, the use of nitrous oxide, laughing gas, what they use at the dentist. It gives you a sense of euphoria. It calms you down. And I felt like, well, that's not as bad as an epidural, Pitocin. I would prefer marijuana, but to each his own. Yes, you can smoke marijuana when you're giving birth. It's a herb. Now, I'm not saying get like a gram allowed and like blow your brains. I'm talking about like just get some natural non-GMO weed, and it can definitely help with the pain. Let's see what else we went through. She wants to be kept aware of everything. So she wants the doctor or her midwife to, constantly explain all procedures and everything that's being done, because instead of being treated like you're just a patient or you're just something that they're working on, she wants to be treated like the whole person that she is. So like I said, she wants the explanation of every procedure they're doing. We also have those. She decided to do no residents, no student doctors, which I can understand. Some people, their birth is very intimate for them and they only want close family members. Sometimes people just want the father in the room besides the midwife and the doula, because it is a very sacred moment once that baby crowns and the baby comes out, and they get to bond as a family. Speaking of crowning, she wants a mirror so she can see the baby crown. And also, a lot of women have been getting back into when their baby crowns, they're kind of to reach down and to help guide the baby out with the midwife, which is great to do. There's nothing wrong with doing that. She wants immediate skin to skin contact. She wants a delayed cord clamping. I asked her to consider the lotus birth, letting the cord naturally fall off. So we'll see, if she decides to do that. Also, all tests or exams that they that they perform on the baby, she asked that they be delayed for as long as possible so they can bond, and also so she can breastfeed. And also, when they do the exams and the tests. She asked that all exams and tests be done in the room in front of her. And before they take the baby, she wants to be informed. They're not going to just, she doesn't want them just taking the baby and then coming back. She doesn't want any medication or, where is it? Yeah, she doesn't want any medication or anything given to the baby without her knowledge. She's okay with the vitamin K wash. She wants to do a 1 hour delay for the eye ointment. She doesn't want any pacifiers at all. She doesn't want the baby to get used to that. As I said again, breastfeeding is a big thing. She's asking for a TENS unit to treat pain. But it depends if they have a unit on hand. Let's see what else. Saline lock preferred as opposed to heparin lock. Like we said, her big thing is she wants to avoid medication at all costs. Like, and she just wants to do pain management. And I'm all for that, okay? And okay, let's see. She wants to put together a birth playlist, which is always a great idea. It's very calming and relaxing. Or, you know, if you might want something to turn up to, look, it's your birth. You design it and plan it the way you want to. So I made sure to tell her do her birth list, her playlist now before she gets, you know, too busy with getting things together or prepared for the baby. And, you know, you don't want to be trying to do a playlist while you're crowning or when you're starting labor. What else on the list? We're going to do lights dimmed. And if the hospital lets us or the center lets us, we'll do candles. That's her preference. No circumcision. She's having a boy. And she doesn't want to have a circumcision. To each his own. I definitely agree with her. My children will not be getting circumcisions, but it's a judgment-free zone. If you want to do that for your son, go ahead. I wouldn't recommend it. It puts the baby in a tremendous amount of pain, and it's also a very traumatic experience for them. But as I said, if that's what you choose to do, so be it. As I said before, she wants to be consulted before the baby is given any foods or medications. Delayed cord camping. Okay, so we pretty much went through her whole birth plan. We also talked about, you know, once I make sure that the baby is breastfeeding properly, and that both mom and baby are doing well, I will excuse myself because now is the time for the baby and the mother to bond as well as the father. It's family time. It's the golden hours. We discussed about having her mom bring her older daughter, who's like around 5, bring the daughter to the hospital after the baby is born, after the parents have had time to bond, and then they can all bond as a family. But as far as like extra visitors, friends, family, that can always wait. You know how the old folks used to say, don't be having no anybody, you know, in your baby face. Like, that's the thing. The baby is newly born, is new to this world, so you don't want just random energy around your child when it's basically forming itself and still like building up immunities, and your baby's, you know, brain hasn't even like kind of formed all the way, and that skull hasn't closed. So like, you know, just that the baby's skull not being closed all the way, think of that also as far as spiritually, like their protection hasn't completely formed. So it's really good to just be with family, close family, for the first few days after the baby is born. And I also told her we're gonna get her a welcome to motherhood package. I feel like we all should get a gift. I'm pretty sure her husband is gonna get her a push gift, but the welcome to motherhood gift is one coming from me, the doula, and it's just to show appreciation and celebration of her motherhood. I also will be checking in with her for her postpartum for up to 42 days, and just being a support system for her baby, and her family. And basically, it's something that I love doing. I'm really excited. It just feels so good working in this field. I started this journey almost 2 years ago, and I don't know, it's very fulfilling. I'm passionate about it. I love to read and study and research and learn more. So you guys, I would definitely recommend, if you want to make a difference in the Black community, become a Black birth worker. You can become a doula. You can become a midwife training. A midwife assistant, or a midwife, yourself. Soon, hopefully, I will be begin my midwife assistant training, as well as my nursing training for to be a licensed practitioner or an RN. I think I found a bridge program that can get me to become a registered nurse in a short amount of time. So basically, Sister Yoni is here to help Black women along their journey. I'm here to help you create the birth of your dreams. I'm here to support and guide Black women and Black mothers, and this makes me happy. It's something I'm very passionate about, and I look forward to having my own children soon. But thank you guys for taking the time to watch this video. If you know someone who is expecting a child, or who wants to start trying to conceive, just let me know. My email is wombwarriordoula@yahoo.com, and that's WOMBWARRIOR doula, DOULA@yahoo.com. My Instagram is Doula Goddess Amara, DOULAGODDESSAMARA. The website will be up shortly, in a few months, and you can also contact me by phone, 504-952-1721. Peace, family.